In my mind, I thought a new implant in my butt is gonna look great. So I went to my original breast doctor to see about doing the butt augmentation through him. However, he wanted to charge me a lot more money. So I decided to go out of the country to Tijuana. I went into Mexico and had the procedure done.
Where in Mexico?
Tijuana.
Tijuana. You decided to go to Tijuana for your plastic surgery?
Yes.
If you're gonna have plastic surgery, please do not go outside the country. Now there are, I'm sure, many fantastic plastic surgeons in Mexico and other countries, and even potentially in Tijuana. But the problem with doing plastic surgery in another country is that you don't know the medical system there. Is your doctor a real board-certified plastic surgeon? Is that doctor's training similar to what a plastic surgeon here in the United States would get? And there's always a risk when you travel outside of your country for surgery, because what if you have a complication? And if you don't speak the language in that other country, how are you going to communicate with people in the hospital or in the surgery center? You really want to take all these things into account before you go and have plastic surgery in a different country than where you live.
To do a butt augmentation out here, you're looking between 10 to 15,000. And in Mexico, you're gonna spend between 3 to maybe 4,500.
This is a big reason why so many people leave the United States and have surgery in other countries. It's basically to save money. But you have to consider that you have added risks. If, once again, you have a complication, how much is it going to cost to pay for those complications in this other country? Or when you return to your home country, like here in the United States, you return back to the States, who's going to take care of you?
What happened?
The doctor said that he could do fat grafting on me, but I would have to gain some weight. When I got there the day of the surgery, I didn't have any fat to graft. And I already had saved, my money and paid the doctor. So he said, okay, well, the next option is butt implant.
Right.
So she went to a different country, planned to have a Brazilian butt lift. Now, never mind that the Brazilian butt lift in the wrong hands has the highest mortality rate in all of cosmetic surgery. But then the doctor determines that you're not a good candidate for it because that doctor has probably never seen her before and decides to do buttock implants, which in and of itself has a high rate of complications like infection. None of this is good. None of it.
So he sent a courier service to go pick me up some. They were bigger than what was supposed to be put in. He said he was putting in 650 cc's.
Wait. 650 cc's? cc's? That's when we do breast implants.
No. This guy put breast implants in her rear end? Oh my gosh, I have never heard of that. Buttock implants are made to be solid. They're made of solid silicone. They're like rubber. Breast implants are made of a gel. They're made to be soft and move around. You can't switch these two up. That's a horrible idea. To me, that just proves that this doctor either only cares about the money or has absolutely no idea what he or she is doing.
When she came home after surgery, she got a real bad infection.
Oh, you did?
I had a whole leaking fluid, a lot of fluid.
If you get infection in that part of the body, one of the types of infections, the most feared infection that you can get, is flesh-eating bacteria. Approximately 50% of people who get a severe infection with flesh-eating bacteria will die from it.
You've seen this result,
It looks
right?
like testicles, the swollen.
Boy.
Balls.
My grandma just said my butt looked like balls.
Oh my gosh, her grandma just said she's got balls for her butt. Oh my gosh, that poor woman. I'm only laughing because she and her grandmother are laughing too. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Okay, let's see.
That's good.
Okay, so hold this right there. I'm just gonna shake you a little bit. I just wanna see how loose it is. Right, shake it. So it is really loose.
Buttock implants are made to be firm, not soft like this. And so that movement is definitely not surprising because they're breast implants.
This feels like a silicone breast implant.
Yeah, but I have to tell you, it almost feels like it's under the muscle, though.
Does you think this is a 650 cc implant?
This is a 650.
That's like a double D implant.
Two things that I would take from this video. Breast implants are made up to 800 cc's, so 650, you're getting really up there. It's probably about 2/3 the size of my head. The second thing is you may have noticed that neither doctor was wearing gloves while they're examining and touching and feeling her buttocks. This is considered very standard of care, but over the past several years, I've gone to wearing gloves whenever I examine my patients. I think it may make them feel a little more comfortable.
Step in Jana's surgery will be to remove her implants through a small incision in her buttock cleft, then close up the pocket. Next, we'll do a butt lift, removing her tattoo in the process.
This looks pretty standard. You remove the implants, you close the pocket up, and then the idea is to remove a strip of skin above the buttocks, and you're able to then pull the buttocks up. This does leave a permanent scar though at the top of the buttocks. Usually you can hide that with underwear or with a bathing suit.
Wow, how many times have you seen a breast implant being pulled out of someone's butt?
Never.
Wow.
I can't believe someone did that. It's scary.
Now you may have noticed if you look carefully, this is a textured breast implant. This is a breast implant that is made to kind of stick in place. Obviously it didn't when you saw her kind of jiggling her buttocks. But the other thing is that these implants are also associated with a very rare type of cancer called anaplastic large cell lymphoma. This is a rare type of cancer that can occur in the scar tissue surrounding that breast implant. And that can conceivably occur in the buttocks if the implants are there as well.
We've lifted up both sides of the buttock. We've got a really good lift going.
Yeah.
Her buttock is nice and high and tight, and we did everything humanly possible to give her a good-looking buttock.
It's definitely lifted.
I hope she likes it. I hope Grandma likes it.
So it's hard to tell on the operating table how great it's going to look, but you can see that is a long scar at the top of the buttocks. And because of that, it is not a super popular operation. A buttock lift is usually done in people who've lost a lot of weight and the skin in the buttocks is excessive. It is rarely done in people who just don't like how their buttock looks and they're just looking to have it lifted, mainly because of the length and the visibility of that scar.
Right, this way. All right, so we are finally here. Oh, hurts.
Does it hurt?
Yeah, we need to touch it. Not no more.
We'll go slowly, okay?
What I'm hoping to see today is a regular booty. Hope it's not a pancake booty.
Look at this cute little buttock.
Wow, looks really good.
It does.
I mean, you know, it looks post-op, okay, so.
One day after surgery, you look like hell. It does not look good. You're bruised, you're swollen. She has drains in. Those drains are there to basically remove any fluid that can accumulate in that old buttock implant pocket. You want that pocket to close off on itself. And that yellow gauze that's at the top over her incisions is called Xeraflow. Now that has an antibiotic impregnated into it, and it does two things. It helps reduce the risk of infection, but also helps to prevent that incision from sticking to the other bandages. Now let's see how she looks a few months later.
I feel sexy. I feel beautiful. I feel like I can go out and show people what I have without having to second guess myself. Before, I had squishy buns. My old butt needed a bra. Now I have a cute little tight tushy. There's no tattoos, there's no implants, and I am glad to be rid of all that junk in my trunk.
Props to Dr. Dubrow for doing a fantastic job with her. She really does look great, and I'm so glad that she is happy and feels great about her body. Here in the United States, all good board-certified plastic surgeons are members of either the American Society of Plastic Surgeons or the American Society for Aesthetic Plastic Surgery. If you're thinking about breast surgery or cosmetic body surgery, then definitely pick a member of one of these societies. Well, this patient isn't the only one who had major issues with her backside and horrible complications. Take a peek at this episode right up here where I react to a recent episode of Botched, where Dr. Dubrow fixes a different woman's buttock major problem. And if you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.